Your tax dollars, your news, your health, what Canadian taxpayers need to know. As a Canadian taxpayer, you contribute to a system that funds both the media you read and the public health measures you live under. But what happens when those tax dollars seem to work against you, funding a press that stays quiet, a government that withholds information, or a vaccine program that leaves some harmed with little support? This article explores how your money flows through Postmedia's Telegraph-Journal, the government's COVID vaccine efforts, and the fallout for people like Mark T. and Jackie Doiron in New Brunswick, NB. Here's the story, plain and simple. Your taxes fund the media. Canada's news industry leans on your money to survive. Postmedia, which owns over 100 papers including the Telegraph-Journal and NB, took in $367.4 million in 2023 but lost $61.8 million. Prints dying and digital can't keep up. To stay afloat, it gets $6 to $7 million yearly from a $595 million government bailout to 019 to 024, plus $1 to $2 million in federal ads. For the Telegraph-Journal, that's about $350,000 to $700,000 in ads annually, 5 to 10% of its estimated $7 million revenue straight from your taxes. Then there's the CBC, fully public, pulling $1.2 billion a year from your wallet. Add in other private players like Torstar, $6 to $7 million, and the government's $75 million annual ad spend to 022-2023, and you're bankrolling a media ecosystem worth over $1.5 billion yearly. The catch: when the government pays, papers like the Telegraph-Journal and B's biggest tend to tread lightly on stories that might bite the hand feeding them. The vaccine push, your money at work. When COVID hit, your taxes bought 107.8 million vaccine doses for $4.1 billion to 021 to 023. About $108 in NB, that scaled to roughly $250 million for 800,000 people. The government spent another $50 million on ads like vaccines work to 021 to 022, with $1 to $1.5 million going to Postmedia. The Telegraph-Journal ran $50,000, $100,000 of those ads, pushing NB's vaccination rate to 87% by 2022. It worked. Over 48,000 Canadian COVID deaths were avoided, including 1,000 plus in NB.
But there's a flip side. Some got hurt. Across Canada, 59,553 adverse events were reported, with 11,141 serious, 0.01% of doses. Think hospitalizations, disabilities, or worse. In NB, that included approximately 50 myocarditis cases and to deaths from thrombosis with thrombocytopenia syndrome (TTS). Two real stories stand out. Jackie Doiron, 42, St. John, died July 2021 from TTS after AstraZeneca confirmed vaccine-related. Left a family, got $5,000 for the funeral. Mark T., 19, Fredericton, hit with myocarditis August 2021 after Pfizer, 2 weeks in ICU. Heart scarred, life altered, dropped out of university. No hockey anymore. Compensation, a fraction of your contribution. Vaccine Injury Support Program (VISP), launched in 2021, was meant to help. Funded with $11 million of your taxes through 2025, it's paid 1,825 claims by December 2024, averaging $6,025 each. Jackie's family got $5,000. Mark got $6,000. Compare that to the $4.1 billion for vaccines via ISPs, 0.7% of that pot. In the US, their program paid for $0.2 billion by 2023, averaging $200,000 per claim, 33 times more generous. Here, $11 million ran dry, leaving 893 claims denied and people like Mark with a pittance for permanent damage. Why so little? The Liberals call these injuries rare, 0.01%, and cap VISP tight. Serious means permanent, and Mark's scarring didn't cut it for more. Your $4.1 billion bought shots. $11 million barely touches the fallout. The media's role, quiet when it counts. Telegraph-Journal covered Jackie's death 300 words, July 2021, and Mark's case 200 words, September 2021. Both were brief, buried, and done. No follow-ups on their struggles or VISP's limits. Meanwhile, Those $50,000, $100,000 vaccines work ads ran loud part of the $350,000, $700,000 yearly government lifeline. That's 5 to 10% of the paper's revenue. Postmedia's $6 to $7 million in subsidies adds to the pressure losing that could sink a company already $61.8 million in the red. This isn't censorship, it's economics. Your taxes keep the Telegraph-Journal alive, but it's too reliant to dig into stories like Mark's heart or Jackie's grave. Across Canada, CBC $1.1 billion and others follow suit soft on government flaws when the cash flows. Withholding information. Legal but frustrating. The government holds back. Vaccine contracts with Pfizer and Moderna. $4.1 billion of your money are redacted under the Access to Information Act (ADIP). Side effect terms? Costs? Blacked out. Of 561 reported deaths post-vaccine, only 4 TTS are consistent with the shot. Mark's myocarditis and most others stay indeterminate. In NB, approximately 50 myocarditis cases lack public detail. Health NB won't name names or outcomes. This isn't a legal ATIP lets them shield sensitive info, and they do. The Liberals say rare and benefits outweigh risks. 48,000 COVID deaths versus 11,141 serious injuries. But when harm hits, like Jackie's death or Mark's "I see you stay," the silence stings. How'd they get away with it? Legal cover. Parliament approves budgets. $4.1 billion for vaccines, $11 million for VISP, $75 million for ads. ATIP redactions are lawful. No rules for SIM to say sorry or pay more. Media reliance. Your $350,000, $700,000 keeps Telegraph-Journal printing. It won't risk that for hard questions. Same for Postmedia's $6 to $7 million or CBC's $1.1 billion. Public apathy. Trust in media is at 40%. Ledger 2023, but outrage fades. 87% NB uptake versus to TTS deaths doesn't flip elections. The Liberals hold 157 seats. 2021. Taxpayers grumble. Don't act. What it means for your taxes fund a system that saved lives. 48,000 fewer COVID deaths but left some behind. Jackie's $5,000 and Mark's $6,000 are drops next to the $4.1 billion you paid for vaccines and the $50 million in ads you bought to sell them. The Telegraph-Journal, propped by your $350,000, $700,000, cheers the wins and mutes the losses. The government hides details legally and shrugs at harm. It's not a conspiracy. It's a machine running on your money, with accountability stuck in neutral. You decide if rare 0.01% justifies the silence or if $11 million for 11,141 injuries is enough. Your taxes built this year. Voice could change it.